Thank you for inviting me along today. I'm Maria Mullen. I'm from the Maggie Centre in Manchester, and today I'm here to talk to you about self-compassion, particularly in the context of a cancer diagnosis and treatment. So, what I'm hoping to kind of focus on in today's session is just having a little think about normal emotional responses to a cancer diagnosis. Thinking a little bit about the role of the human mind and how it can be quite tricky for us to navigate, can cause us some problems. And then we're going to start to have a little think about self compassion and what that is. Also, thinking about how do we foster or cultivate self compassion. And then, hopefully, all being well, the final 5 minutes, we're just going to have a little practice of a soothing breathing rhythm exercise. And then there will be an opportunity for any questions at the end. So, just touching initially on normal responses to a cancer diagnosis, treatment, and beyond. So, I've used the analogy there of a roller coaster. This is often how I've heard people's experiences described when they've been diagnosed with cancer. Um, that is typically something that feels quite frightening for people, but suddenly it's that idea of being strapped into that roller coaster that you absolutely do not want to be on, but you're on it and it's moving and it's terrifying. You do what you have to do to get through that, but along that way, along kind of the loop de loops and being kind of thrown here, there, and everywhere, there's lots of feelings that you might experience. I've popped some of the more common ones along the bottom there. That's not to say that you will experience all of them feelings. For many people, all of them may resonate. So things like feeling quite numb, in shock, disbelief, frightened, confused, maybe quite angry. And for some people, there's guilt and the shame in there, and they can feel a bit more difficult to kind of sit with. And then also things like sadness. And for some people, they might report feeling quite hopeful. So it really does just depend. But I think the point that I want to make is that if you experience any of these feelings, it is completely normal and that is to be expected. And we're going to have a little think about why that might be. So I've used the term tricky brains. We all, as human beings, have a brain that has evolved over thousands and thousands of years to become quite complex and quite sophisticated. So I think if you kind of take yourself back, think about kind of cavemen, cavewomen, at that time, their main kind of aim was about survival and reproduction. And actually, part of that survival was not just escaping danger, it was also making sure that you fitted in as part of the group because we survived in groups. So actually, kind of that being quite an important point that we want to take forward today. Then, kind of as our brain has evolved even further, it's learned to kind of process emotions and for us to feel emotions. And then the more kind of modern brain, which we see there on the diagram as the neocortex, is our human brain. That is the brain that enables us to think about our own experiences. So we're not just dealing with fight or flight, we're not just dealing with emotions, we're also trying to make sense of what's happening. So the bigger our brains got, the more problems it has started to cause us. Don't get me wrong, it's great in many, many ways. You know, it's made us kind of be able to advance science and medicine because of our imagination and kind of what it is actually capable of. But also it can monitor and judge. So we might do that towards ourselves. We can be quite critical about ourselves and how we're coping. We have the capacity to worry and anticipate. So maybe thinking about the future and what could go wrong. And also we can become quite frightened of our own feelings. So for example, anxiety, what does this mean? Why am I feeling this? So again, trying to make sense of that. And we might also kind of move into the past in terms of our thinking, ruminate on experiences, kind of run over memories and what happened in an attempt to make sense of it. And very importantly, we make comparisons. So we can be quite judgmental towards ourselves and how we're coping. We have fear of rejection. We might feel that we're not good enough. And all of this ties into the evolution of the human mind. So this is absolutely not our fault. We are just navigating life with the brain that we have been given. Um, it is doing exactly what it's supposed to do. And I think that's the key point to make. It's all about survival. So even these kind of more modern day experiences that we have now, it will treat in the same way as an external threat, let's say. So it will kind of act on a better safe than sorry approach. And in the same way, we therefore might experience a range of different emotions that come part of that kind of fight, flight, or freeze response. So the diagram that I've popped up here is a way for us to try and make sense of our emotions and what we might be feeling. So you might have never seen this before, so I'll just quickly kind of talk us through it. Um, we'll start with the red system down there at the bottom, which is the threat system. So this is very much our kind of freeze, fight or flight system. It's the one that kind of detects the threats and keeps us safe. So it's very much about survival, and it will act on that better safe than sorry approach. So if an external threat was in front of us, such as a tiger, maybe kind of thinking about our cavemen ancestors, it will treat that threat in the same way as it will treat an internal threat. So that might be a thought about the future, about something going wrong, it will act in the same way. So this is where our stress hormones come into play, such as adrenaline and cortisol. And we might feel some of those threat-based emotions, such as anxiety, anger, or disgust. And then thinking about the blue system, this is our reward system. So this is what technically it's our motivation system. It's where we get kind of a sense of achievement. We move towards behaviors that make us feel successful, and it might be feelings like excitement and joy, or wanting and pursuing. And our attention in this system can become very focused. So it is a pleasure-based system, versus kind of that threat-based system, but it's very much more about achievement. And then the green system over here is our soothing system. So again, this is a pleasure-based system, but those pleasurable feelings look a little bit different. So this is a system where we feel quite content, we feel safe, protected, cared for. And this is where oxytocin is stimulated, and that's kind of the hormone of love and connection. So this is very much an affiliative system where we bond with other people, we feel connected to other people, and it's a way that we can manage threat. So we can help to kind of reduce that threat system by activating our soothing system. Sadly, though, in this day and age, in these kind of modern worlds, we're so busy, and life is quite hectic, and we do kind of do a lot of comparison within our kind of social circles and in life generally. So there is less opportunity for our soothing system to come into play. But today we're very much thinking about the soothing system and how do we bring this online a little bit more, with the idea that if we can bring these three systems into balance, as the theory would propose, this will help us to regulate our emotions. I guess what we do know is that cancer absolutely activates that threat system. And, for people affected by womb cancer or endometrial cancer, there's lots of things that will activate that threat system. And I guess a few things that come to mind are things like fertility, relationships, intimate relationships, impact on kind of sense of self and femininity. So there's a lot of things that will bring that system online and make that the more dominant system. So it's having a think about how can we activate that soothing system to help manage that threat. So what we're kind of talking about today is how self-compassion might be a helpful way to do that. as a way to activate our soothing system. So self-compassion, a leader in self-compassion is a lady called Kristen Neff. If you're interested in exploring that any further. But essentially, self compassion is a source of strength and resilience in times of distress and challenge. And what this comprises of is three elements, which we're going to focus on today. So, the first one being this idea of self kindness, taking care of ourselves. So, being caring towards ourselves in the same way that we would to someone we love, a relative, a friend, and affording kind of the same, you know, attention and support as we would do for other people. It's also recognizing that because of our tricky brains, because we've all got one, actually there's a sense of common humanity. So every individual will experience pain in some way, will have these difficult emotions and thoughts to deal with the idea that hopefully this removes that sense of isolation and helps us to feel connected with other people in those moments of distress. And then thirdly, mindfulness is a key component of self-compassion. So that's being open to the reality of the present moment, being aware and noticing what is actually showing up for us in that moment. So what thoughts and feelings are there, and actually being responsive to those without any harsh judgment or criticism, because we know that actually it's going to be there because we're a human being and because of the way we are wired up. So it's thinking about how do we use mindfulness to refocus our attention in a non-judgmental and compassionate way. So just having a think now about how can we activate our soothing system through self-compassion. So this is the ladder of compassion. So if you're interested in looking any further at this, I've put the link to the website below, which talks really lovely kind of through this ladder of compassion and what it's all about. But we'll have a quick think about it now. So it's the idea that actually being compassionate towards ourselves can be really difficult because it opens us up to vulnerability, and we can feel quite anxious about being vulnerable. So therefore we might experience a bit of resistance when we try and be compassionate towards ourselves. So it proposes kind of taking a graded approach to this, starting small and then building up over time, having a think about what those steps on that ladder might look like for you. So this is just an example of what it could look like, but for you as individuals, some of these things might feel more challenging. So I'd encourage you to think about what this might look like for you and change the order of this in any way that feels appropriate. But I think if we look at it here, it talks about starting with just noticing. So noticing moments of compassion, whether that be from other people and that compassion directed towards us, but also noticing when we're kind towards ourselves. So when have we said, actually, it's okay to slow down right now, it's okay to stop because I'm experiencing quite a lot of distress. When do you feel good enough, and actually pulling on those moments of compassion and just noticing can be a very, very powerful tool in itself, particularly if often the dominant voice is maybe that inner critic. We want to be actively looking for moments of compassion that we direct towards ourselves. And we're going to have a little think about kind of the next steps on the ladder now. So we're going to touch on mindfulness, we're going to touch on soothing breathing, and we're also going to touch on those self-compassionate exercises. So mindfulness, obviously being a key part of self-compassion, can be really helpful for the reasons mentioned. So often in these busy lives that we all lead, we may be thinking a lot about what's going on for us and how we're feeling. So actually our mind might be quite full of thoughts about the past, thoughts about the future, what's to come. And actually that can lead to a lot of uncomfortable emotions, versus this idea of mindful, where, as you can see there, the dog is having a very kind of mindful walk where he is just taking in kind of that whole experience, and drawing on his five senses of what he can see, hear, smell, touch, and taste. Um, so mindfulness is very much thinking about, where is your attention? So, where is it focused right now? And is that helpful for me? So, what you might start to notice is that your mind becomes consumed by thoughts about the future. So, is this going to come back? Or what will the future of treatment look like? And if you find that you get stuck there and hooked or consumed by that thought, and that actually doesn't serve you very well, and it can result in a lot of distress, it's about recognizing that that's where your mind has gone, and just gently and non-judgmentally refocusing your attention in something else that's happening in that present moment, which is where your five senses might come in. So I've mentioned on there informal mindfulness practice. So there is courses and things you can do around mindfulness, one of which we have here at Maggie's, which is an introduction to mindfulness 6-week course. So that will really help you to get to grips with what mindfulness is all about, and why that can help to activate our soothing system. Essentially, it's the idea that when we're more present, we can make, or we can respond to distress and make decisions from our soothing system, rather than those threat-based responses, which might be more of our autopilot response. So there is more kind of guided practices. Equally, you might choose to do some informal mindfulness practice. So, for example, if you are brushing your teeth, which is something we typically do on autopilot in our day-to-day lives, it's an opportunity to slow down and connect with that experience in that present moment. So, what can you see when you're brushing your teeth? What can you hear? What can you taste? What can you smell, etc.? And what might happen during that is that your mind wanders, and that's what human minds do. So that's absolutely okay. Remember, it's all about better safe than sorry, and kind of um, protection from threat. So it will wander, but it's about being able to notice that that has happened and just gently redirect your attention back to the task at hand. So that might be a mindful shower, that might be a mindful walk, that might be a mindful experience of washing up the pots. You could do that with absolutely anything. But if you are interested in finding out a bit more about mindfulness, or giving that a go and starting off with some more kind of scripted practices, I would recommend the Headspace app. And also the Velindre Cancer Centre in Wales has developed an app which has mindfulness practices on it, which I know a lot of people I've worked with have found really helpful, really accessible, and it's free. So just something to be aware of. And then just having a think about that kind of higher step on that ladder, which was the compassionate self exercises. So, some ways that we can try and foster self compassion is through doing a perspective shift. So, thinking about, how would you treat a good friend or a loved one going through a really difficult time in their life? So, what would you say to them? What would you do? What would those behaviors be? What actual words would you use when you're offering compassion? um, and just drawing on some of that and directing that inwards. So almost taking your own advice and turning that in towards your own distress. So it's the idea that we are accepting and we are compassionate towards what we are living through right now, the context that we just find ourselves within. um, Another suggestion might be a compassionate letter writing exercise. So, this is the idea that you write a letter to yourself. It might be quite a generic letter based on kind of how you feel when you are distressed, but equally, it might be in relation to something quite specific. So, for example, around how you feel about your femininity, and actually thinking again about, What would I say to myself? What words would I want to use? What tone of voice? What manner do I want to respond to myself in? How do I want to look after myself? And writing this in a letter to yourself, acknowledging that distress and saying, it's absolutely okay to be feeling this right now. This is part of the situation that you just find yourself within. And actually, this is kind of what you need to hear. So you can write that to yourself. That's something you can put down and you can come back to whenever you need it. And then there's some other ideas around reframing that kind of inner critic dialogue. So that critical self talk, noticing when that critic is present and what it is saying, and reframing that from your compassionate mind. So what are the alternative compassionate responses that you need to hear right now in this moment? And again, thinking about how you might treat a good friend or a loved one can help you to think about what them responses might look like. And finally, a self-compassion journal. So keeping a record of the times where you are kind to yourself, and how that made you feel, maybe versus the times when you've been quite hard on yourself and how that has made you feel. Um, and also maybe keeping a note of how you see others responding to distress, how they comfort themselves or how they comfort other people might become part of that journal. So if you are interested in finding out a bit more about how to do those kind of compassionate self exercises, I would direct you to Kristen Neff's website, which is selfcompassion.org, as you can see there on the slide, and it will talk you through how to practice those, which is really helpful. Um, and I think just be aware as well of what supports around you. So remember, kind of with your soothing system being part of feeling connected and bonded with other people, people who understand, people who can kind of validate and normalize that distress. We have a lot of support here at the Maggie centres, which I would encourage you to have a look at your most local centre and see what's on offer there. But we do have a gynecological support group here, the second Tuesday of the month, and that's an opportunity to meet with other people who are going through similar experiences, hopefully to remove that sense of isolation, which we know can be very common for people and can significantly affect how they feel. And as mentioned, we have mindfulness courses, we have courses on managing stress, which do touch on self-compassion. So just have a little look, and I would encourage you to come and drop in if you are local to the Manchester Centre, and we can sit down and have a think about your experience and what might be helpful for you at this time. But also knowing that your cancer nurse specialist is there, and also your GP if you just feel you need that extra bit of support whilst you're at any point on this pathway. So just to finish, I thought it'd be quite nice to do one of the self-compassion practices, which is the soothing breathing rhythm. So this will take about 5 minutes. Hopefully, we should have enough time. So this is very much about kind of finding a soothing breathing rhythm, with the idea that this will activate our soothing system, and once we're in our soothing system, we can choose how we want to respond to our distress. And it gives us the opportunity to kind of sit back and think about what would be most helpful for us in any given moment. So just note that in this practice, it does talk about holding an object which gives you comfort or a feeling of gentleness and calm. If you have got anything to hand around you at the moment, feel free to grab that or have it near to you for when we prompt in the script. But if you don't, please don't worry and just continue focusing on your breathing during that point of the practice. But for now, what I'd say is get as comfortable as you can, sitting where you are, and place both your feet flat on the floor, about a shoulder's width apart, and just rest your hands in your lap. You might want to close your eyes, or if that feels too uncomfortable, you might just choose to look down at the floor and lower and soften that gaze. And I invite you to bring a gentle facial expression. So that might be just a slight smile into the practice. So now I invite you to gently focus on your breathing. As you breathe, try to allow the air to come down into your diaphragm. Feel your diaphragm, the area under your ribs, move as you breathe in and out. Just notice your breathing and maybe play with your breathing a little bit. Maybe breathe in a little faster or a little slower until you find a pattern that for you seems to be your own soothing, comforting rhythm. It's like you are checking in, linking up with the rhythm within your body that is soothing and calming for you. What many people usually find is that their breathing is slightly slower and deeper than normal. However, I will now introduce a breath count. Feel free to follow this or just find a rhythm that's comforting for you. So I invite you to breathe in for 3 seconds, hold, and then breathe out for 3 seconds. Continue to do this for a few moments. And just ensure that the breaths in and out are smooth and even. And just continue with that for another 5 breaths. Now you can spend a little while, for as long as you wish, just focusing on your breathing. Just noticing the breath coming down into the diaphragm, your diaphragm lifting, and then the air moving out through your nose. Maybe you can notice the point just inside the nose where the air enters. So in through your nose and out from your mouth. In through your nose and out through your mouth. And just focus on that for a little while. There's no need to change anything. We're just gently observing your breathing rhythm. Now gently turn your attention to your body. Notice the weight of your body resting on the chair and the floor underneath you, allowing yourself to feel held and supported, coming to rest in the present moment. Remember, it's perfectly okay for your mind to wander during this practice. That is exactly what human minds will do. I encourage you to just simply notice that happening with curiosity about where your mind has gone, and then gently guide your attention back to an awareness of your body as best as you can. And now just sense the flow of air coming in through your nostrils, gently observing, No need to change anything, just allowing things to be as they are. If you find yourself focusing on your breathing a little bit difficult, which some people might do, and that's okay, then allow your attention to turn to that object. So you may find something that you like to hold, such as a smooth stone or a soft ball, just something that gives you the feeling of gentleness and calmness. And now, as you focus on your breathing, also focus on your object that you are holding, just noticing how it feels in your hand, resting. Move your gaze to your object as best as you can, staying with the sensations of holding it in your hand. And when you feel ready, slowly open your eyes and bring yourself back to the present moment. You might want to have a little stretch and a deep breath to prepare you to carry on with your day. And I hope everyone found that helpful for those of you that decided to have a go. So that does bring us now to the end of the session. So thank you everyone for your time.